And here is your stem. Liver injury was not mentioned in my stem. I don't know why. Ribs fracture is there. So must have been on the right side. Yes.
Okay, ma'am.
Ready? Okay, so
Yes,
if you've read and understood, considering it critical care scenario, please tell me, how are you going to manage this patient?
I'm going to manage this patient according to ATLS protocol, and I will go for ABCD approach. First of all, I will check patient's airway by speaking to the patient. If patient is able to speak, I will assume patient's airway is patent. If patient is not able to speak, I will look for any foreign body or any secretion or any severe kind of facial injury. And I will first do the chin lift jaw thrust maneuver, and I will remove any foreign body or secretion from the oral cavity. And then I will try to feel patient's breath on my cheek, and I will listen to any abnormal breath sound or any stridor, inspiratory stridor. And if any suspicion about the airway, I will go for oropharyngeal, nasopharyngeal airway. And if that doesn't work, I can go consider endotracheal intubation or in a surgical airway. And then after ensuring airway is patent, I will go for cervical spine protection, and I will do cervical spine immobilization by hard cervical collar, tape, and a sandbag.
Good. And then breathing.
And then I will go for breathing. I will check patients. I will inspect if there is any open chest injury or any flail segment, any unequal
Obvious. Yeah.
chest wall movement, any
Okay.
central cyanosis. I will feel patient's trachea is in central position or not. I will check if there is any subcutaneous emphysema, and I will do percussion and auscultation for any abnormality or any feature of pneumothorax or hemothorax.
Okay. What is more important when you're managing breathing part of ATLS?
I
Counting
have to check
respiratory
respiratory
rate.
counting
Respiratory.
rate and depth of respiration.
Okay.
Yes.
Okay. Right. Now, for this scenario, what would you do as part of management?
And if there is cervical spine injury, I will closely monitor the rate and depth of the respiration. If there is shallow, because there may be shallow breathing, if C5 or above injury, there will, if phrenic nerve is affected due to weakness of the diaphragm.
Yes. So to take care of breathing, you will arrange high flow.
I will arrange high flow oxygen, 15 liter per minute.
Through what type of mask are you going to give oxygen?
With a tightly fitting face mask, or nasal cannula, or non-rebreather mask. Yes, ma'am.
Just suppose on breathing, on inspection of breathing part, you realize that patient could have pneumothorax. How are you going to take care of that?
Then I will immediately, if I suspect for tension pneumothorax, I will go for immediate needle thoracostomy at the 4th or 5th intercostal space along the midclavicular line. Then subsequently, I will do the tube thoracostomy.
Okay. Right. After doing your primary survey, you asked for this image. I don't know if you could appreciate the injuries. Yes. Clearly, you've already said that you'll take care of, immobilize the
cervical spine.
Yes. So, all right. Now you've done this X-ray. Can you please help me and read this?
This is a chest X-ray AP view showing translucent lung field on the left side, with collapsed lung margin, with mediastinal shifting towards the right side, but trachea is still in the central position. There is obliteration of left costophrenic angle and bony
What does that show?
thorax.
How would you diagnose this? How would you interpret this as a surgeon? So
And
road traffic accident case, and
yes,
these arrows are showing you something. So how are you going to interpret this? And
maybe
because
there
your
may,
further management is going to be
yes, ma'am, this is a pneumothorax, left-sided pneumothorax.
okay. What is the difference in pneumothorax and surgical emphysema?
As surgical emphysema, pneumothorax, if there is any open pneumothorax, there may be surgical emphysema as well in the
So
subcutaneous
what
layer.
happens in the case when patient presents with emphysema? How would you
The
define it?
air spaces coalesce to form a large air space, and that there will be air leakage in the subcutaneous tissue, and
Okay, what is the management here?
here for the pneumothorax, I will give tube. I will give intercostal chest drain.
Okay, first urgent needle thoracostomy.
Urgent needle thoracostomy,
Yes,
then
and
tube
then you'll insert the chest tube.
in
Then
the
how
yes,
are
ma'am.
you going to take care of the shock or the circulation of the patient?
Yes,
How are
ma'am.
you
I will
going to?
then move forward for circulation. I will look for any external hemorrhage and try to stop the bleeding first, and then I will open a two wide bore cannula. I will take sample for full blood count, urea and electrolyte, and blood glucose, arterial blood gas analysis, and also for cross matching of 4 unit of blood. And side on the side by side, I will start crystalloid fluid for resuscitation. I will give you catheter for measuring monitoring the urine output, and I will over the period I will monitor the patient's pulse, blood pressure, urine output, patient's peripheral warmth and capillary refill,
And
and
heart rate.
heart
And
rate,
what else? Mental status.
mental status.
Okay.
Then on, I will move forward to check the disability, to count, check the Glasgow Coma scale,
Yes.
and also to check patient's pupillary light response, and if there is any focal neurological deficit present or not. And then on
Yes.
exposure, I will go for log roll maneuver to check patient's cervical spine as well as any posterior lung injury.
All right. According to the according to the definition, in which class of in which class of shock is this patient in right now?
Ma'am, patient has unstable vitals, but
And breathing difficulty as well.
yes, ma'am. Patient might be in class class 2 or
No,
forward.
3 to 4. Okay. Yes. How have you determined that? Shock
Hypovolemic
2 to
shock is
3. Okay.
classified into 4 categories.
Yes.
Class 1, in class 1, there will be pulse will be less than 100, almost within normal limit, and there will be no change in blood pressure within normal limit, and urine output will be more than 30 ml per hour, and also the respiratory rate will be 14 to 20 breaths per minute. In class 2, there will be more than pulse will be more than 100 beats per minute. Respiratory rate will be 20 to 30 beats per minute with normal blood pressure, and urine output will be 20 to 30 ml per hour. In class 3, there will be hypotension. There will be pulse more than 120 beats per minute. Respiratory rate will be more than 30, 30 to 40 beats per minute, and urine output will be 5 to 15 ml per hour. In class 4, there will be hypotension as well as tachycardia more than 140 beats per minute, respiratory rate more than 40 beats per minute, and urine output less than 5 ml per hour.
Okay. Fracture of which vessels determines the grade or the class of shock? Which bones? Like this one, patient has fracture of the foot.
Foot, yes, ma'am.
Yes. So it probably does not qualify because the fractures of long bones and
Long
pelvis.
bones, yes, ma'am.
Good.
There will be massive hemorrhage, yes, ma'am.
Yes, good. Thank you. Okay.